everyone, and welcome to Mental Health Insights on Enlightened Community. Today, we have a very special guest. She is an expert, not just charming and intelligent, but has 20 plus years of experience in the field of mental health. We have with us Parveen Shaikh, psychologist, career counselor, a skill development facilitator. He is the head of outreach and collaboration at Empower, which is a mental health initiative by Aditya Birla. So let me welcome Parveen Shaikh. Thank you so much for joining us.
So thank you, Ume, for being so kind in introducing me. You make me sound like a rock star. So thank you so much for the introduction. Lovely.
So you are a rock star. And our today's discussion, as you know, Parveen, will be centered, since it's Mental Health Day, will be centered on how we can be positive and keep a positive mindset in this COVID era. So to start off with, Parveen, you've shared with me that you yourself have experienced being COVID positive and you've just recovered from the disease. So if you could share your experience as to how did you discover that you were COVID positive? Did you have any symptoms and how are you feeling now?
So I'm feeling great by the grace of God right now. I'm fine. I'm out of it, out of the quarantine period. So I felt sick 3 weeks back and I was feeling very tired and I didn't have too much of fever, but I was feeling down for a couple of days. So my doctor said it's just maybe you're just tired, burnt out, just relax. But on the third day, when I lost my sense of smell and taste, and that's a very big indicator for COVID, the virus. And that's when I said, okay, I have to get myself tested. And that's when I got myself tested. And obviously, I went to the government facility to get tested. And I was obviously tested positive by the PCR test, the immediate test which they give you. This is called the antigen test. And then I got another test done from a private organization because the government organization doesn't give you the viral load. So it was very important for me to know the viral load because I am somebody who has all the core morbidities. I have diabetes, I have high blood pressure, I am 45, 43, I'm obese. Okay, so all these comorbidities made it very difficult. Everybody panicked. I also panicked. Oh my God! And that's how I got to know. And the minute I got to know, I got myself quarantined. So fortunately, I live in a house to myself. So I got myself quarantined, and that's when it started. So that's how I got to know. To know my journey, Ume, the initial reaction was shock. Because in my whole house, I was the only one being super careful about everything. Sanitizing like crazy, using the mask all the time. And I was like, how did I get it? So that was a shock.
So tell me, how did you manage? So once you came to know, what was your initial reaction? I'm sure even though you're a mental health expert, and know how our cognitive processes and body function, but at the end of the day, we are all human beings. So what was your initial reaction and how did you take it?
So when I was sitting my mother had come with me and my brothers had come with me. The minute I got to know I'm positive, it takes exactly like 2-3 minutes and they tell you you're positive. So I was shocked for like exactly 2 minutes, I think. And the first instinct I had was to tell my mother, please go away from me. Okay, I moved away from my mom because I'm scared. My mother is an old person. And then I just sat for a minute and I said, okay, let me first logically think, who was I in touch with, And then it was my partner, Anurag, and my mate, the two people who I was in touch with. So I thought, okay, let me first. So I called him. I said, come and get tested. They both were negative. So they came immediately and the test was done. They were negative. So that was done immediately. Then I just left my family and they were all like shocked and my mother was crying and it's so much of fear around COVID. But the doctors were really like the BMC people. I should really appreciate them. They were so relaxed. They were so chilled. They were telling me, it's okay. You have no symptoms. Relax. Don't worry about it. So I just came to my house and then I just sat for some time trying to analyze, okay, what is happening to me, So because I had read so much about COVID, I'm a psychologist. The first thing you need to understand is you hear a lot of things, but you have to focus on what is happening to you. You can hear of people dying, you can hear of people, having issues, but what is happening to your body? So when I spoke to my family doctor, he asked me questions and I answered to him honestly. He's like, don't get scared. Tell me what you're feeling. Do you have fever? Do you have cold? Do you have cough? Do you have irritation in your throat? Are you, so I had lost my sense of smell and taste. So I sat with my doctor, as in I spoke to my doctor, and he asked me to tell him what I'm feeling. So instead of getting scared, I focused on what actually I'm feeling, So I was actually okay. I was just feeling very tired and very exhausted, So that was the only thing. And then he told me certain precautions thing, like I had to check my oxygen thrice in a day to see if my oxygen is fine, my O2 level is fine, check my fever regularly, check my blood pressure, and check my diabetes.
Okay.
Because these things are very important for somebody who has these conditions. Okay. I had to eat properly, drink lots of water. Of course, there was the kada, the Indian kada, which everybody wants to have. And I can tell you, I think it really helped me. Maybe it's I don't know, this is psychological or whatever, but it really helped me. So I got, obviously, I was alone at home, and I'm privileged to have my own house to myself. So I got myself quarantined. I started having some, precautionary medicines, vitamins, multivitamins. So the first week, I was extremely tired and exhausted. So I was very tired, always sleeping, just getting up to eat. So that was slightly difficult. Now, one precaution thing which I did which was good, because I have these comorbidities. I had to understand what's happening inside my body, because otherwise nothing was happening to me. So I had to get some blood tests done to understand what is happening inside. And I don't know what tests they asked for, many tests. So there was a guy who came to my house wearing the PPE kit. I was like, oh my God, to take my blood. Then I went all in a PPE kit to the CT scan person to get my chest CT done to understand the effect on my lungs, because that's what COVID does. And the results were normal. My lungs were slightly infected, so my doctor started medication. And then I was at home quarantine. So that's how I went step by step. First week I was sleeping. Second week I started working because I was just bored. So I started working a little bit. This is the third week. I'm almost done with the third week. I've done my 14 days. This is the 18th, 19th day. And I'm fine. I'm working properly. Same energy has come back. The smell taste came back in a couple of days. So that's how the whole process finished.
So Parveen, thank you so much for sharing your fear, because you yourself are a mental health expert, and I personally, knowing you're a very cognitively very strong person. But you said that when you heard about it, you yourself were shocked, and there was a fear and anxiety period that you went through. So I'm sure the entire population feels the same. But tell us now something about your quarantine period. How did you? So you said the first week was full of maybe spending some more time sleeping. But how was your second week? And how did you ensure that you are mentally keeping yourself fit?
So because I'm a psychologist and I'm currently working with all of these things, so I know it can get a toll on you. So and I am also, I have anxiety. So I'm already on anxiety pills. So you can imagine how it must be creating havoc in my mind. But I've learned those tricks, because I'm a psychologist, of acceptance and being in the present. So I was following all the mindful techniques I've learned in my life. Being in the present, breathing mindfully, talking mindfully, reading mindfully. I would consciously not read, not see anything which is triggering anything in my head. I was always coming back to, like my doctor said, come back to what you are feeling. Come back to what your body is telling you. I was being always in the present, because that's very important. So when I would get up in the morning at 10 hours of sleeping, and I would still feel sleepy, instead of feeling, oh my God, something's wrong with me, I would say, okay, my body is having a virus, which is difficult. My body is telling me to rest. Just let's sleep. Or my body is telling me, okay, I would sit on the window and just relax, and I would feel the urge of wanting to go out. And the most painful part for me was, when we got to know this, the BMC came and told in my building. Not that my building people have treated me badly or anything, but there's a panic in my flow because there are small kids there. So I was feeling so guilty. Have I unknowingly transferred it to somebody? So that was there, but I was always being like, no, I was always, whenever I went out, I had the sanitizer. So that part plays on your mind. And what also worries was troubling me was, I would open my door and my partner, my mother, my brothers were standing out and watching me. And I'm a, how I am. I'm a loving person. I want to hug people and whatever. So that part was painful, but I was like, okay, it's 4 days, it's 3 days, or it's 10 more days, like one day at a time. So that kind of helped. And I would not keep, I talk a lot, but I would just tell, like the first time when I got COVID and the day I came back and it sunk in me. Then I remember that night I spoke to my boyfriend on WhatsApp call and I cried. And he asked me. So I said, I'm just feeling very overwhelmed. I want to cry. So that's when I cried. I felt better. Then the next time I cried was when I got my chest x-ray and the report, and it said some mild infection. That's when I cried a lot because somebody I know had the same amount of infection and had to be hospitalized, So that's when I cried. So I did not stop myself from crying also. If I felt like crying, I cried. But one thing I must tell you, in COVID, your strength of your mind is one thing, but it's also the privilege you have of having loved ones around you. Like my family, my brothers, my mother, my partner, you Ume, you message me every day, Jenny, so many of my colleagues, all of Empower, my boss, Mrs. Birla, they messaged me regularly, spoke to me regularly, that really, my friends, Ami, Sony, they all were so supportive, and it was so nice, because that's when I realized in that time when I was alone, I'm actually not alone. I have this whole bunch of people loving me like crazy, So that added to my mental, my the way I think and the way I am positive kind of supported me in this whole quarantine period. But the isolation is real. You feel isolated. But when you have people around you who care for you on your video call, on anything, like when I got my smell and taste, I became this person who wants to eat all the time. Okay. So I wanted to eat. Yeah, exactly. So, my sister-in-law, like my niece, sending me different foods, my friend cooking and sending me food, packaging, and all of that. So sending me all this nice doklas and all of those things, and Thai curry and chola and parathas.
You're saying one way of dealing with this virus is it's not social distance. It is the social love. We all need.
Yes.
See, we need to be in touch. Yes.
I'm still socially distant. Like, I have finished my quarantine period, but I'm not meeting anybody. I'm giving it one more week. In fact, I had finished it on 6th only, but I'm going to give it a couple of days more. I'm not going near anybody, but I don't feel like that. I feel I'm fine. And in a couple of days, I'll be fine. I'll go and I want to hug my mother. So I'm going to go hug her in a couple of days. But social distancing is okay as long as you maintain emotional togetherness.
Of course, the emotional connection, yes, of course.
That is very important. So that kind of helped me, yeah.
Yes. And of course, it is a difficult person for somebody who's going through it. And as you said, you need to be aware as to what is happening to me. But Parveen, there could be many people who may be actually feeling the physical symptoms. And for them, then being mentally healthy is very important. Or mentally strong is very important. So Parveen, you spoke about various things, that you are doing. Positive thinking, or the thinking, being in the present, but it's not easy for everybody to understand. If you could emphasize a little bit more or explain and tell our viewers as to how one can be mentally healthy, or what are the things, and if you could explain those things.
So see, as you have physical health, you have mental health also. So as we have a COVID or a fever or whatever, it's something which is going on in our mind. And all of us have mental health. Sometimes we have a low day, so that day our mental health is not good. So specifically for COVID, I would tell everybody, the first step is stick to what a doctor is telling you. Stick to what your body is telling you. That are the two important things. You have to be honest with your doctor and honest with your body. Like, listen to what your body is telling you. Your body will tell you what to do. So listen to that. So that's the first thing. The first logical thing is, we get very emotional. So first be logical about what is happening to me currently. Okay, so many people are dying, people are getting infected. I understand that. But what is happening to you and what can you do about it? Now for mental health, the whole thing is, the resilience which you have developed. Okay, if you are somebody who is resilient, who can understand. See, we can go both ways. One way is, oh my God, I have COVID. Oh my God. And that will affect your immunity, and immunity is very important during COVID. So you see how it goes if you go negative. But if you say, okay, I have this is my situation, now how I go ahead with this, how do I deal with it, then your immunity boosts high. So I also read about laughing, watching. I saw the whole season of Schitt's Creek.
Okay.
The whole season is a lovely I saw all romantic movies. I'm generally don't see much Netflix. I avoided, I avoided seeing anything realistic at that time because I was like, I don't want anything, troubling my mind. I saw all the mushy movies. I played music. I even danced at some point, after I felt healthy, I just switched on the music thing and I was like, okay, I want to, on all the Jennifer Lopez songs I dance just to, release the endorphins and all the, dopamine, all the positive happy hormones so that, I can just be happy. So mental health, step one is knowing you have mental health. Okay. Mental health is not mental illness. Mental health is health, no? How physical health, mental health. So knowing mental illness and knowing you have mental health, as you fall sick sometimes, your mental health is also goes low sometimes. First step is knowing that. Second step is it can be prevented. So if you have a lifestyle, you have a support system, you talk to people, you interact with people. Like I remember, I wrote to all of you, I wrote to all my friends from my end that I have been detected COVID positive. I already take precautions of taking care of my mental health. So by being self-aware, by watching happy things on TV, by keeping in touch with my family and friends, by talking about my symptoms to my doctor so he can assure me. So I prevented any mental health problems by preempting all the issues and taking care of all of these things. And if I would have since after my father passed away, I have developed anxiety. So initially, of course, it was shock and grief and I was taking medication. But I realized I have anxiety. So when the COVID pandemic started, my anxiety became very high because of the uncertain situation. And there is nothing to do with COVID. It's because of the pandemic, my whole anxiety. So I started taking anxiety medication also. There is nothing wrong in accepting you have a problem and taking medication for it or therapy for it. It is not a taboo at all. And believe me, it's been 3 months I've been taking anxiety tablets and I sleep well. And so the first thing is stamp out that stigma around mental health. How would you go and take a paracetamol when you have fever? Or an antibiotic. So if you need help, if you think that I'm not being able to take care of my mental health, go to a professional, a psychiatrist, a psychologist. If you need medication, take medication. If you need therapy, take therapy. So you can prevent it also and you can manage it also. You can do both.
Yes.
The only first step is to be aware about it and remove the stigma. There's nothing wrong in that. I don't feel ashamed in telling that I'm a psychologist and I have anxiety. There's nothing wrong in that. I think I'm a great psychologist. I think I do my work really well. My anxiety is not troubling my work. I'm just aware of it and I'm taking care of it. So my anxiety could have tripled during COVID. But because I was so aware of it, I managed it really well. So yeah.
So very important point that you mentioned is to take help from the right person. So of course, no self-medication. If you think that, you have some you're feeling anxious or depressed, speaking to a psychiatrist or a psychologist is the right medium which one needs to take. So you summarized and told us many things, that you've been doing throughout this quarantine period, Parveen, an excellent way of coping. And thank you for sharing that with our viewers. But, not everybody has that privilege of having loved ones around who really care. And sometimes it becomes very difficult, especially for people who are staying alone. what would you tell people, how can they reach out to, or, is there, like you shared about your initiation that you're doing through Empower, where, people who need to talk to somebody can call on a helpline. If you can share with our viewers as to how they can talk to a psychologist, especially the ones who may not be able to afford it, how they can go about it. Please, if you can share.
So Empower, where I work, thank you, ma'am. Empower, where I work, is a social enterprise working towards mental health awareness, mental health intervention, destigmatizing mental health. We advocate mental health. So Empower has a foundation, has a center. You could check out the website and you can take appointments. It follows a very professional way of counseling. So when you go to, there's so many people who call themselves counselors, and there are some psychiatrists who just give medication. But in Empower, we actually screen the individual for the problem. If they require medicine, then only we give medicine. If they require therapy, then we give them therapy, or we give a combination of both. There are different kinds of therapists, trauma therapists, relationship therapists, child therapists, adult therapists, geriatric therapists. There are different specializations. And if you cannot afford to go to a center, our foundation is a subsidized rate. You need to be in that level to get a subsidized rate for counseling, clinical care. And we also have a helpline, the Empower one-on-one helpline, which has started in April. And to date, we've got over 60,000 calls. Okay. If you feel lonely, if you feel you have nobody to talk to, just call up that helpline. It's a 24/7 helpline. It's manned by psychologists, and you can talk to them and they'll talk to you. And we get so many calls of people who feel alone, and when they talk to us, they feel better. So I am lucky to have friends like you and family who love me, and my colleagues are great. But if you don't have that kind of support system, please call the helpline and speak to them. I'll give you the number, Ume. It's 1800 120 820050. So 1800 120 820050. Call 24 hours, professional psychologist. So and just if you want to, like, sometimes we get calls of people who are just bored and they want to talk.
Yeah.
And that's okay. That's okay. That doesn't mean that they have a problem, but they're just lonely at that time. So see, the point is, mental health, unlike physical health, mental health affects you much early in your life. So it can impact. So if I am depressed, how can I work? It affects your quality of work. It affects your quantity of work. If you find out about it early, just take steps to take care of it.
Wonderful points, Parveen. Thank you so much for sharing the helpline details to our viewers. Also, you shared with us a lot of important and insightful information as to how one can be healthy, keeping away with bad news, seeing positive movies, enjoying ourselves, being relaxed, doing and being very mindful about being in present. So thank you for sharing all these important points.
Yeah, and I just want to add one more thing. I want to thank the government of Maharashtra and BMC. I'm in Bombay, so that's why they checked on me every day.
Oh, wow.
So they called me twice in a day, every single day, very politely called me to check on my health, to check how I was. So even if you don't have family and friends, I think the BMC people are very happy to speak to you. Yeah. They would ask me about my fever. So even if somebody, like, I would not forget to check my fever, BP, but they would still check on me. Like, have you checked your fever? How much is your fever? What is your oximeter reading? So the government is doing a great job, actually. They came to my building, they informed my neighbors, they told them to take care. Then they sent somebody to sanitize my floor. So I think the government is doing a great job. So look at the positive things. Don't look at the bad things which are happening. There are a lot of good things happening. I'm personally experienced the government doing a great job with me. But they check literally till now, till today morning. For the first call, 8:39, I get from the BMC.
Wow. That's
and they
wonderful.
call in the evening again. Yeah, so the bigger company, the bigger BMC office, and then my local BMC, the Kurla where I stay, that BMC calls me to check on me every day. And I've
not heard a lot of people speak so much positive about the government, and I'm happy that you have been able to highlight that. point.
No, that's true, because because I don't know, it's all hearsay, na? Government is doing this, government is doing that, but I've experienced it, so I should be honest about it. Like, and they are very polite. They are not doing their job just for the heck of it. They talk to you very properly, and they check on you, and they also check on you. Like, they ask you, is there somebody taking care of you? They'll tell you, do you want to talk to somebody? Please call. So it's really good. So look at the positive part. See, what I'm hearing right now, the infections are only increasing for God knows why. So you have to be taking precautions, especially if you're in India, in Maharashtra, in Bombay. I was taking all the precautions, yet I got positive. So please, I'm asking all of you to wear a mask, wash your hands, be sanitized, be careful. And even if, God forbid, you get positive, just don't get scared. Listen to your body, listen to what your body is saying, your doctor is saying, and take the right step, and do not delay testing. I tested immediately the minute I lost my sense of taste and smell, because you will infect more people. So just be very mindful of that. The government is helping you, your family will help you, and you are the one who will help you. So you should help yourself the most. Yeah.
Thank you so much, Parveen, for so much of insights and learning. Thank you very much for being on the channel and for your precious time. Thank you.
Thank you so much, Uma, for inviting me. Thank you.
Videos, do like, share and subscribe to our channel. And don't forget to press the bell icon next to the subscribe button.